I was introduced to the concept of the microbiome in 2016 when I was approached to do my PhD in the microbiome during pregnancy and infancy, and it was the first of its kind in Australia. I didn't know what the word microbiome meant at that time, so I quickly looked up the definition and thought that it was a very innovative, cutting-edge part of science that we hadn't developed a full understanding of. My interest is high-risk obstetrics, and I felt like the microbiome might play a role in the development of complications of pregnancy, like gestational diabetes and hypertensive disorders of pregnancy, such as gestational hypertension and preeclampsia. And so trying to add to the puzzle of what these conditions were about is what drove me to do this in the first place. In my daily clinical practice, the most common question I get asked by women is, do I need to do something if I have a caesarean section to give my baby the right bugs? So that's where the field of microbiome sits from a patient's perspective. So women out there are asking the question around the vaginal microbiome and are getting bits of information around the benefits of vaginal delivery versus caesarean section. I like to hold the space of giving them the most up-to-date scientific information that we have, which also balances the fact that some women need to have caesareans, and I don't want them to feel guilty about that need. Yeah, I think society as a whole is becoming more conscious of reconnecting to our roots and where we've come from. And from that point of view, the microbiome is becoming a hot topic of discussion. It's definitely has a distribution amongst even a geographical area. So there's some areas of Sydney where that question is much more frequently asked and the discussion is much more in depth. So I think it's around educating all women from all walks of life in all geographical areas around this new and exciting cutting edge of science and its implication on the long-term health of themselves and their babies. So the research that I've been involved with as a clinician, so I was very much a duck out of water, started with the Microbiome Understanding in Maternity study. So that's the MUM study. It's the basis of my thesis and my PhD. And basically what we then did is springboarded the concepts of whether the microbiome changed in pregnancy and had implications and impact on pregnancy outcomes and the microbiome health of their babies, and whether we then needed to study whether preconception health of the mums and her partners was an important factor. So one study's led into the other based on the same study protocols and procedures to keep it all very consistent, but adding in that preconception information to the MothersBabies cohort. It is the largest of its kind in the world. They're very difficult studies to run, and we're hoping that we add to a very important scientific piece to the puzzle for the worldwide health of women and their children. Research into women's health in general is poorly funded in Australia and worldwide. It's very difficult to justify research. I think people think that it's very difficult to justify research into things that aren't disease processes per se. So being pregnant is normal, if we can call it that, part of a woman's reproductive life. The disease processes that are interesting are gestational diabetes and preeclampsia and their long-term health impact, but a lot of the research is done in preterm birth. I think the interesting part about microbiome research in pregnancy is that it is new and that the first papers were only published about 10 years ago. So in the medical and research field, 10 years is actually quite a short period of time, whilst it feels like a long lifetime away. So I think it's about embracing this new area of science and understanding where we can use it in a normal setting like pregnancy, and also investigating the abnormal parts that the microbiome can play: inflammatory bowel disease, schizophrenia, mental health, autism, asthma. So this is a new area for women's health research. Look, I think the important part around education and looking at women and their mode of delivery and their breastfeeding options is in part a personal story of mine. So I have a beautiful daughter. She's 6. Her name's Abby. I had a vaginal delivery. It went to plan as best the plan was. I didn't really make a plan, and I breastfed her until she was 3 years old. And I have a daughter who has asthma, anaphylaxis to 3 of the most common food groups, and eczema. So I feel like I impart the wisdom of being a mum with experience in this area, and I say to women that the best laid plans don't always go to plan, and there might be a reason for it, and that's okay. And to not feel guilty around what outcomes happen, because I can do everything the textbooks say and still have a daughter who has lifelong implications for her probably microbiome. I need to study hers too. The mum study in its entirety of what I've done so far is still under investigation. Yep. So we're still running all of the analyses for that. We've shown that there is a stability within the adult. So we understand outside of pregnancy studies that your microbiome is probably formed by the age of 3, with a lot of turbulence and change until that time. And then there's this kind of quite stable trajectory throughout your life from that point. That I can see mirrored in the mum's data that we've seen, particularly with the fecal and the oral microbiome, and as well in the vaginal microbiome that we've studied. So you kind of are what you come into your pregnancy with. The interesting parts of the mum study will be looking at whether the different individual bacteria or bugs or viruses then function differently over the course of the pregnancy, as opposed to them being made up of something different. Look, I think the importance of the fields of research in microbiome says that this is important from the day you're born. So it's important from when we're in our own mother's tummies to when we're born and as children as we develop and grow, because of that really rich time of change before the age of 3. I think when you haven't had a consciousness about it or an understanding about it, and you're like me and you're in your 30s, then anything you do to try and return to your roots, eat more holistic food, come back to, as everyone has been discussing in the panel discussions around wholesome eating, diversity being the key to everything, then that time can happen as soon as the awareness is there, which is part of what we're doing here, is trying to educate so that at any time point you haven't missed the boat. There is an ability to alter and modify for the better long term at any point. Absolutely. So amongst my clinical colleagues, there's a lot of questions asked about the microbiome. I know when I started my research study, I had every midwife and registrar and obstetrician in the hospital going, "What are you talking about?" So there's not a lot of information out there for clinicians. You know, it's hard to decipher the science in microbiome work, and I'm fortunate enough to be part of a lab which discusses that on a weekly basis to see where the science is up to and see the evolution. So we need to have accessible snippets of information for clinicians as well as the general public. Look, I think MothersBabies is an organisation that strives to empower women and to educate them. So for me, that's my ethos of my life, and that's what I do in my clinical practice as well. So to be offered to be part of, or invited to be part of the MothersBabies kind of movement and creation of information sharing for women and the community more generally speaking, I feel like it's a bit of a privilege to be in that position and to have had the basic science and clinical background to offer some support and advice along the way. The bit of advice that I'd like women to know is to not feel guilty, is to say that there are so many societal impacts and influences that will impact upon us, our bodies and our microbiome, and that you're all doing the best you can with the information that you can. I think the difficulties that I've had in the scientific research of the microbiome during pregnancy is that we know that science changes all of the time. So my great fear is that the information that we share now in 10 years' time will be disproven or obsolete, and I suppose it's holding the space of uncertainty whilst trying to give the most correct, accurate information that we can. Science has a really important role to play in the development of understanding how the mum passes on her bugs to her baby. A lot of information is out around vaginal seeding. It's one of the most common questions that I get asked. I guess what the important thing is to understand is that we're evolving into a space which, despite all of our interventions or necessary interventions for obstetric practice, caesarean sections, antibiotics for group B strep prophylaxis and things like that, that we can do some things to help change or modify the baby's microbiome by passing on what the mum naturally has. One option is vaginal seeding. We place a gauze in the vagina of the woman and then basically rub the vaginal fluid over the baby's face, eyes, mouth, back and whole body, replicating a vaginal birth for that child. The research is suggesting that that does have an impact, and our local policies and procedures haven't come to grips with that at the moment because it's a risk versus benefit kind of weighing up of the options of whether we should be doing that routinely. So vaginal seeding is requested amongst some of the patients that I look after, particularly in the public and the private sector in Australia. And the important thing there is information sharing in an accurate way, to say there is some evidence to say that it does make a difference and has an impact, but at the moment we haven't had the consensus statement to say that we would endorse that for everybody. And again, it's difficult because then mothers feel guilty one way or the other. Am I now going against medical advice because I want to do vaginal seeding? So I help empower women to make the decision, and then the decision is theirs. The development of science and where it's leading to might in fact lead to a future where we do a stool sample or a poo sample pre-conception or in early pregnancy to be able to then determine whether these women are at risk of developing things like gestational diabetes or preeclampsia. Recent research has showed that there are associations between those pregnancy outcomes, and if there's something we can then identify, complement, eliminate or add to the woman's microbiome pre-conception, we might be able to change the clinical course of her projected pregnancy in that way.